Hello, and welcome to this evening's podcast, A Seat at the Table. Thank you for joining us here today. As you know, our podcast is designed to serve as a conduit that directly engages predominantly Black communities with decision makers and those with connections to them, ultimately ensuring communities' needs are met by accessing valuable resources. Today, we will start off with an infamous question that we're always used to asking. Is there a doctor in the house? Well, tonight at A Seat at the Table, we have the answer, and the answer is yes. Today's esteemed panel will cover a topic that we have been discussing, especially in the Black community, since, almost over a year now, we'll say. And this COVID-19, the vaccination, we're going to touch on various aspects today, but in lieu of me trying to act like the subject matter expert and or those in Music Man Multimedia Studios, we have the opportunity to have esteemed guests here with us today that are in not only the healthcare professions, but as leaders in the healthcare professions as doctors. So without any further ado, I will introduce our esteemed panel. After everyone is introduced, what we're going to do is have them do a short intro. In that intro, 2 minutes or less, we are going to ask them to clearly state who they are, their area of practice, and why today's topic on this podcast is of uttermost importance to them and why they decided to join us here this evening. So first, we have Harrisburg's own, a classmate of mine, Dr. Julianne Adams Burke. We also have with us Dr. Dangleben. We have Dr. Henderson joining us this evening as well. We have Dr. Fitzgerald here. And finally, we have Dr. Nduko. Now, what I like to do is clearly open this up. I can't thank you all enough for thinking it not robbery, of course, to join us here today. Bring your subject matter expertise and also your personal feelings, thoughts, ideas to the table here with us this evening. We look forward to a robust, open, honest dialogue and discussion. Not only between myself and the panel, not only between the community in the panel, but amongst yourselves as well. So if there are any direct questions that you have for one another, please clearly, state that. If there are questions that you may have for the community, please put that out there. Everyone's listening. They can all hear us. And those questions would then be fed to a stream, in which point I can then highlight those. You'll be able to see them as well. So we are definitely ready to go. The community is loading up into the feed. So without any further ado, we'll go in the particular order as you can see yourselves, hopefully on the screen. Dr. Adams Burke, Dr. Dangleben, Dr. Henderson, Dr. Fitzgerald, and Dr. Nduko.
Thank you. Thank you so much, Karl. Um, so yes, I am Dr. Julianne Adams Burt. Burt is fine. I'm not hyphenated. I am a gynecologist, practicing gynecologist, board certified in OBGYN. I do hail from the great Harrisburg, Pennsylvania. Very proud of my roots and of my beginning. Go Harrisburg High, class of 1991. I have been in the metro Atlanta area essentially ever since moving here for undergrad. I went to Clark Atlanta University. Actually taught high school for a couple of years before returning to school and attended Morehouse School of Medicine. I went to Pittsburgh for my residency training, and I realized, Karl, that it really is cold in Pennsylvania. So that is exactly why I returned back to the South. I guess my parents are from South Carolina, so I guess I had Southern blood in me as well. But as a gynecologist, I just want to share, you said we want to be honest, so let's be very transparent. As a gynecologist, essentially a women's health specialist, I pride myself on my one-on-one interactions with my patients, and I like to say I get into their business. And lately, I will tell you that I have been asking patients almost daily about their desires to get the coronavirus 19 vaccine. And I've been pretty surprised over the last several weeks to months. I am proud to say that I am, I guess, one of the completely vaccinated folks out there. I received the Moderna vaccine, but I do want to be transparent before I turn the mic to the next and say I was one of those people who said, I'll get that vaccine, but I'm not going to be first. Operation Warp Speed, no, that's not for me. I'll be in the back of the line. And then as time progressed and the information was shared with us, I became personally way more comfortable. And that is why I am not. Thank you for having me, and hope I can lend something to the conversation tonight.
Definitely. Dr. Dangleben, sir, please.
Yes, I'm Dr. Dale Dangleben. I'm a trauma surgeon by training. I'm the trauma medical director at Penn State Health Holy Spirit Hospital over in Camp Hill. Started that program coming up on 5 years now. So been in the area for a while. I'm originally from the Commonwealth of Dominica in the Caribbean. Very proud of that. Went to school there. Actually, I taught high school there for a few years prior to coming here. And I went to Hunter College, where I majored in chemistry, and then I went to Penn State University College of Medicine in Hershey. From there, I went on to Lehigh Valley Health Network, where I did my general surgery residency, and I did a fellowship in trauma, and I stayed on faculty there for about 8 years, and I moved around for a bit prior to coming to Penn State Health. So the reason why I'm doing it, I've been speaking for a very long time on issues that matter to us as a race, as a people. I have been very vocal for many years. So this is not new, talking about what happened to us as slaves, what happened in the Tuskegee experiment. So I understand what has happened to us as a people. However, what I have also seen on the front line with this virus is pretty rough, and I think it has taken its toll on us both psychologically and also clinically. So again, I think by using conspiracy theories, people have sort of cast a dark shadow on us as a people, and we're setting ourselves back. So I always say that the risk of the vaccine is less than actually getting this virus. I've seen what it's done to people. So when I saw the percentages of what people were saying, especially from the Black community, that they were not going to take it, I had to step up and talk about it. I have gotten both shots of the Pfizer, and I have done many social media appearances talking about why we should be vaccinated, and I'll definitely chime in a little more later.
Thank you, sir. Dr. Henderson.
Yeah, yes, thank you, Karl, and thank you for having me, and thank you for allowing me to be on this panel. I'm a practicing internal medicine physician, total practicing for 23 years. Born and raised in Queens, New York. I attended St. John's University, did fellowship at residency at North Shore Hospital in Sloan Kettering. And I practiced at Metropolitan Hospital in Spanish Harlem and Central Harlem for 7 years. And then my wife and I moved to Chambersburg, Pennsylvania in 2004, where I practiced inpatient and outpatient medicine. Joined Hershey Medical Center in 2015, and I've been a medical director now of COCO Outpatient Center just for the last 2 months. But the reason why I'm honored to be on this panel is, as practicing internist medicine, I've treated at least 20 or 25 or more patients post-COVID. And I know the impact in the Black community of comorbidities regarding high blood pressure, diabetes, obesity, and chronic kidney disease. And if you look at how COVID has impacted the Black community, disproportionately than any other race, many of us have these health conditions. So what can I do to inform my patients, to educate patients, to reach out to the community to, correct any myths that they have out there? And like even today, one of my patients who I know who's 53, her brother died of COVID 3 months ago, and her father died 4 months ago from COVID. And she still had reservations of the vaccine. She thought that it was a chip in the vaccine. She's African American. I had another patient last week who's 60 years of age and high blood pressure. He said, I'm going to wait. Now, I said, what are you waiting for? So I had to educate him to say, the longer we wait, the more chance that it's going to affect us, affect him. So anything I can do to educate the community, to inform, to and just see and just let them know what I've experienced. But I'm willing to take questions and just honored to be here. So thank you.
Well, thank you for joining us, sir. Dr. Fitzgerald, please.
Hi, I'm Karima Fitzgerald. I am a trauma, acute care, and critical care surgeon at Hershey Medical Center. I did my general surgery residency right down the road at Pinnacle Health, and then I did my fellowship training at Hershey Medical Center. I am honored to be here because I did jump on the bandwagon of getting my vaccine. I've gotten both doses of my Pfizer vaccine. And the reason why is because I've seen how this has impacted our community, especially. And from a personal standpoint, I have family members who are elderly, and I've seen how they've been affected and impacted. And I wanted to do my part to make sure that I was able to be around them, number one, but number two, to also encourage them so that they wouldn't necessarily suffer some of the things that I've seen in my patients. As a trauma surgeon, we see patients roll through the door and you don't know their status when they walk in. And so every day it's basically a crapshoot. And ultimately, I just wanted to do my part to make sure that I'm protecting my loved ones and also my patients. And I think moving forward, the education that we can provide on this panel, as well as in my practice, is what's going to help change the narrative for our community. So I'm happy to take questions, and I'm very grateful to be here. So thank you for inviting me.
Well, thank you for being here as well. Last but certainly not least, Dr. Nduko.
Hello, everyone. My name is Ife Nduku. I am first generation born in the United States. My family is Nigerian. I have lived in several different places, but I claim Las Vegas as my primary home. I came to Pennsylvania for medical school. After obtaining my MD and getting graduating medical school, I went back to Las Vegas, obtained my MBA, and then came back to Pennsylvania at Hershey Medical Center to undergo my residency training. After completion of my residency training, I joined the staff, and I'm still at Hershey Medical Center as an internal medicine hospitalist. So I work exclusively in the hospital. If you're too sick to be home and you need to be hospitalized, I'm who you see in the hospital, assuming you don't need surgery. Now, I have been on the front lines of COVID and the COVID patients since the very first patient at Hershey Medical Center. It was a very effective, very committed team that admitted that first patient, and back in March. But I've seen it firsthand, up close and personal, at nights and mornings, long days, long nights, long weeks, long months. And I see the toll, I see the severity of this disease. I see how it affects our community, and I see how it's perceived in our community. And it concerns me about the misinformation. It concerns me about the misunderstanding of how we treat it and how we fight it. And beyond the concern, I also, just like Dr. Fitzgerald, I'm concerned about my family. I'm concerned about the people I love and the people I want to protect. I have a grandmother who's 102, who I haven't seen in over a year, and I'd like to see her. So I got vaccinated as soon as I could. I received the Pfizer vaccine, and understanding the severity of this disease and how it affects people, and how there isn't a prediction factor in terms of how you'll come out of the disease on the other side. And I wanted to be able to share my concerns, share my experiences, and answer questions, provide some light, on a topic that seems to have so many shrouded areas and shrouded corners. So I appreciate the invite. I'm very happy to be here.
Again, thank you very much. Can't thank you enough for being here. Let me ask this. We'll start off with this particular question, because as you were doing your intros, you highlighted both the vaccines. Those of you who have taken it have shared that. Could two of you? We'll start off with two of you. Could you share? And I'll go with Dr. Dangleben, and I'll go with Dr. Fitzgerald. If the two of you could share, or actually, you know what? Let me go back. Let me hold off on Dr. Fitzgerald and go with Dr. Burt, because you particularly said you took the Moderna and others said they took the Pfizer. What went into your decision making? Was it based on availability? Was it based on research you've done? So those of our viewers that are listening, they may have those same questions. And to have two of you to have said you've taken different ones being in the field, could you expound upon why your decision making led you to one as opposed to the other, please? We'll let Dr. Burt go first, please.
Well, sure. My decision was not my decision. It was availability. I will say that I had researched a lot about Pfizer, since everyone was speaking of Pfizer, and it was the first to receive the emergency use authorization. I walked in to my appointment, rolled up my sleeve, and the nurse practitioner said, "We have Moderna today." So I kind of felt silly because I had really taken time to read all about the Pfizer via the FDA.gov, their website, and all I could go off of was, well, they say it's similar. So at this point, someone else may be able to speak to it. I don't know. It sounds like Pennsylvania is all about Pfizer, perhaps, but at this point, I don't think that there is a choice, a selection. It is really based on availability. Maybe when Johnson & Johnson, AstraZeneca are added, then perhaps that will be an opportunity that people will have to research for themselves.
Okay, so let me ask, let me delve a little bit more then. If there was a choice based on your research, which one would you have chosen if you had the choice?
Not a good question, because now post-vaccine, I've learned a lot more. In the beginning, I would have said Pfizer, but now there's just a lot of things that will play into that. I'll let one of your other guests speak to that, meaning about the reactions, the so-called side effects. People get are worried about the side effects, and I just caution people to realize the difference between something that is an adverse effect versus something that we are anticipating as a reaction to these vaccines, the current ones that are available.
Okay. Dr. Engelman and Pfizer?
Yeah. It's really institutional availability, so really didn't have much of a choice. It's what was available through your institution. And in terms of the difference, I did my research also. I knew I was going to take it no matter what. The efficacy was 94 to 95% for both. The only difference, I think, was the temperature at which it stored. One was minus 20 versus minus 70. In terms of the reaction is very individual dependent. So it's difficult to see how one person is going to react. So some people react to the Moderna. My lady got the Moderna, and I got the Pfizer, and we had different types of reactions. So it's a little different in that regard. But in terms of the efficacy, I think that was a no-brainer, 95%. So again, I went with the Pfizer. I had no choice because it was institution. My lady went with the Moderna. She had no choice. It was an institution.
Okay. So you touched on possible side effects between you and your better half. Would you mind sharing yours? What yours were?
Yeah, within an hour to two, I had, I felt very flushed. Ran a low grade fever for a while, for a few hours, and I can tell you, within 8 to 9 hours, I felt much better. I mean, it was achy, the arm was heavy. My other half had 2 days of aches and pains, and a lot more than I did. So everyone reacts a little differently to things.
Correct.
But overall, the fact that I got a reaction, I think is important.
Why is that?
Because it shows that it's working.
Okay. All right.
Yeah.
Well, that's what I mean. To those of us, we've had this conversation, and I'm privy to, as a friend, to know. But there are individuals out here that are saying, well, if there is a side effect or a reaction, then that means it's bad. And had I not talked with individuals, in the circles, where I am having access to you all, I may have thought the same thing. And in fact, I did until it was explained properly from the professional side of things. If Dr. Henderson and Dr. Fitzgerald and Dr. Nduku, if you have something to add, feel free at this time.
Yeah, I personally, I had the Pfizer vaccine, and my wife had the Moderna vaccine. Mostly it was injection site soreness that lasted for 2 days with the first dose, and the Pfizer vaccine. The second dose, I had like lymph node tenderness. But like what a colleague just said, you want to have those reactions. That's a normal response. That's, the vaccine is working. On the vaccine, my wife did have a fever for 24 hours, and then it resolved. But I've seen at least 4 cases or 5 where patients had a rash that developed 6 days later, post-COVID vaccine. And that's common as a common reaction. So not a common, but it is a reaction. So I tell patients that can happen, but still no concerns. It's extremely rare for anaphylaxis reaction. They say, I think maybe 11 cases per 1.9 million. So people say, I have allergies to shellfish, but it's extremely rare. And the difference in Moderna, I think with the first dose, I think after the first or second week, you have like an 80% protection with Moderna compared to Pfizer. But then after the second dose, they both are equal, as was stated, 94, 95%. But it's still worth, as you know, receiving the vaccine than developing COVID and the complications.
Okay. So risk versus reward is what you're into with. Okay, understood that. Dr. Fitzgerald.
So when I got my vaccine, the first dose, I didn't have any issues. The second dose, I just had some arm tenderness that lasted several days. Some of my colleagues actually had some reactions where they had flu-like symptoms, but outside of that, the efficacy is very similar after the second dose. So I think that the risk versus the benefit is far greater. One of the things that people always talk about is, well, if I'm getting injected with something and then I have a reaction, then, it's bad, like you said. And the truth is, that's the whole point. Whenever you inject something foreign into your body is supposed to mount an immune response in order to be able to fight it in the future. That's how we develop antibodies, in order to be able to fight the infection when it gets presented to your body. That's the whole point of the vaccine. And so people need to be encouraged when they have these types of reactions and not afraid of it. I know it's very scary to hear that this vaccine came about in such a short period of time. But the truth is, I think that we've actually been preparing for something along these lines. And it's no different than the flu shot that we take every year. And I think that moving forward, it's just going to be better for us to be educated and understand that the Pfizer versus Moderna, both of them will be equally effective after the second dose, which is how they're supposed to be taken. So people shouldn't be too concerned in terms of the difference between the two.
Thank you very much, Dr. Nduku. And I promise you, Dr. Nduku, you will not go last every time.
I'm going to hold you to that, because I'm going to remember, hey, Karl, earlier you said. So I had the Pfizer vaccination as well. I was one of the fortunate ones. I had no symptoms after the first, nothing. I barely felt the injection. I had no symptoms after the first one. After the second one, same thing. I think the next day I felt a little bit of soreness in my arm, and then the following day it was gone. So I was one of the people who was fortunate, who didn't have any symptoms. And I've known a few other colleagues who've shared my fortune and had not had any symptoms at all. But I also do know other colleagues who were extremely fatigued, very worn down, slept all day, felt like their energy was zapped, lasted a couple of days, and then they bounced right back. Other people who had headaches, and then some people whose soreness wasn't isolated to the injection site, but they had general aches and pains. And I'm going to echo, what's been said, is that it's a good sign. Your body responding to the vaccination is a good sign. And those aches, those pains, the headaches, the fevers, the chills, the flushing, the rash that you might see on your arm a few days later, those are all signs that your body is actually doing what it's doing and mounting an immune response to fight the vaccine. So it's doing the right things. And another thing I would say between the differences between the Pfizer vaccine and the Moderna vaccine is that is a time frame between them. The Pfizer vaccine has 3 weeks between it. The Moderna vaccine has 4 weeks between it. Part of that is due to the concentrations of those vaccine doses. And that's why you get a little bit more efficacy with Moderna after the first dose, but you have to wait longer, and a little less efficacy with Pfizer after the first dose, and have to wait a shorter time. But the end result is the same, and they're both equally efficacious at the end of it. And that's what you want in a vaccine.
Great point. So let me ask this, and this as open and round robin on this one here, which is, we all show up as Black Americans living in America right now that we know, which is another one of our reoccurring themes this day and age. We're living in two Americas, and that's black, white, whether it's male, female, so forth and so on. So there are realistic questions out here pertaining to the trust factor in terms of with the institutions that have historically not been kind to us, to institutions that historically have said, trust us, we know what's best for you, just trust us this time. And when we hear that in this day and age coming out from under this previous administration, as Black people in America, living as Black people in America, we understand why there's a mistrust in our communities, especially in the Black communities. Who would like to pick up on that one? Everybody got a chance. So I'll start with you, Dr. Nduku. I promised you, you're first now, aren't you?
Of course, now I'm first. Okay. But so the mistrust is entirely understandable and absolutely warranted. The Tuskegee is probably the most famous example of mistrust that is known well by the Black community and less so by more mainstream communities, the white community, and which is interesting because I didn't think there were so many people, particularly in the medical field, who didn't know about the Tuskegee experiments, and there are, and that's that dichotomy between white community and Black community. Now, the difference here is the amount of misinformation that unfortunately gets pushed, and the push of that misinformation stows fear, which then raises our skepticism appropriately. And when you hear a phrase like Operation Warp Speed, that sounds just dangerous in the field of science. So Dr. Fitzgerald alluded to this earlier, but we've actually been working with this technology for years, particularly the Moderna vaccine and the Pfizer vaccine. They've actually been working with that technology to try to create viruses since the 1990s. They quite literally have decades behind the research and trying to develop these vaccines. And they've actually tried to create vaccines for other diseases using this style. Because of the reactivity and because it was a new disease, they decided a new vaccine process. They decided to hold off. But when COVID came around, they reinvigorated, the technology they had been trying to perfect for decades. So the fear that we have and the skepticism that creeps up when we hear Operation Warp Speed and we think of the Tuskegee experiments, and if you're from Philadelphia, the move bombing, right? You raise your eyebrows raise, but then that's when it's important to go try to talk with the people who might have more information, who might understand the process a little bit more, who might understand the science behind it. And that's when you can discover the research that has gone into this vaccination and be reassured that, I may not trust you, but there's a history behind this that's reliable, and I trust a reliable source.
So yeah, and again, now I'm going to reemphasize the point I made leading into this question. We're coming out from the national administration that was not trustworthy, especially to the Black community. We have a historical perspective in which institutions were not as trusting. And now, even on a seat at the table on this evening, I bring qualified Black doctors here that are in this institution that is, in essence, advocating for this. That may cause even more distrust. Well, why are we out here? Why are we doing so forth and so on, this, that, and the third? But this is what we need to do. Why is it important? And I heard someone touch on earlier, talking about having elderly relatives or elderly community members. It's one of those things where healthy life choices, and oftentimes it's pointed to the men or unhealthy life choices in the family, in the home, the husband and the wife, in which they say, if you're not going to stop smoking for me, at least do it for the kid. Or if you're not going to stop smoking or whatever, or drinking for yourself, do it for the kid. This is along that same parallel. If you're not really convinced on taking this medication or these vaccinations, it's one of those things where doctors or professional those in the profession are saying, do it for someone else. Be your brother and sister's keeper. Is that the type of message that you would advocate for? Why or why not? And is that borderline trying to convince people who otherwise have their mind made up? And is that, is that a moral or professional way to go about things? Just let's talk freely.
So I would like to jump in on that, if that's okay.
Certainly.
So, it's like the whole mask thing, right? So the mask is not necessarily just about protecting yourself. It's also about protecting other people from you. And the people that have been anti-mask from the beginning of this have created this whole hysteria where you're putting other people at risk. And so I think that similar fashion, you want to make sure that you're taking care of yourself, but you being vaccinated or you wearing a mask is also protecting those around you, so that in the event that you are infected or you get exposed somehow, you're not bringing it to your 102-year-old grandmother, like Iffy said, and putting them at risk, because those are the people who are the most susceptible to having complications from COVID. I think a lot of people who are young and healthy look at the situation and say, well, it's just going to be like having a bad cold and I'll get over it and I'll be fine. But it's not necessarily about you. It's about the people with the comorbidities like diabetes or COPD, or even cancer patients who will likely wind up being those cases that you hear about, who wind up on a ventilator, wind up in the hospital for months, wind up on dialysis or having pulmonary emboli or anything along those lines. And having treated those patients, even though I'm a surgeon, I do take care of COVID positive patients. And some of them are elderly and have significant comorbidities, and they don't fare as well as young people do. And so us doing our part by protecting ourselves so that we don't expose those susceptible populations is imperative in terms of getting control of this disease and hopefully eradicating it, or at least creating a herd immunity so that it doesn't affect as many people and we won't see 500,000 deaths a year from this, but rather get it under control, just like the flu. You know, we've seen all these iterations of other viruses that have come and gone, or some vaccines that have basically eradicated certain disease processes. So that's where I think looking inward and saying that you're doing it for yourself, but you're also taking other people into consideration is important.
Thank you very much. What we're going to do now is we'll take a commercial break, let you all get a chance to grab some water, sit back, definitely enjoy our commercials that are getting rave reviews. And if you'd like to have a commercial spot, that'll be coming up shortly in terms of how you can be part of Music Man Multimedia Studios here from the capital city of the Commonwealth, Harrisburg, Pennsylvania. We'll see you on the other side of the commercials.
Hello, this is Juanita Edrington Grant coming to you from the Harrisburg Uptown Building, 1821 Fulton Street, the former Hamilton Health Center building. We are classified as the hub in Harrisburg, PA. You will now see a brief video of what we have named the Castile Edrington Community Room. It's on the second floor, 5th Street entrance of our building at 1821 Fulton Street. We're providing this video to you so that you can get a brief glimpse of our newest addition to our building, which is a room that we are allowing to be used for several different occasions, be it educational seminars, conferences, family dinners. We do have a capacity of holding at least 100 people, which is 10 tables, 100 chairs, or a professional corporate setup. And we're looking to place this information on the Hub website within the next couple of weeks so that you can see more of the advertisement, a price list, and the different information that you may want to know about renting this space. This space was designed by TLC Work-Based Training and TLC Renovation and Construction. Owner and CEO is Tori Castile. Yes, another one of the great projects created by Tori Castile. If you want to get in touch with us, please feel free to call me at 717-889-6377. Look forward to speaking to you from the Hub.
ya, at ya. Tell you what's master, coming at ya, coming at ya. Rhyme style disaster, coming at ya, at ya. Tell you what's master, coming at ya.
From heaven when I saw you, you make me feel like falling for you. Angel from heaven when I saw you.
Okay, welcome back. Thanks for staying with us here at Music Man Multimedia Studios here in the capital city of Harrisburg. All right, we're going to go to questions now. And the first question that we have is dealing with fertility. And so I would send that directly to Dr. Burt, please. The question is around fertility, quite frankly. I won't get into specifics, but the fertility issue is something that is being brought up in our communities with regards to these shots, whether it's the Moderna, either of the vaccinations, we'll say. Could you speak to that a bit, please?
I will try, most certainly. So again, I tell patients on a daily, we know what we know, and what we don't know, we just don't know. So I can tell you that at the moment, the conversation around women currently pregnant and or breastfeeding and receiving the vaccine, it is a personal decision, but not one that is rooted in any known research around safety. I can tell you I have several colleagues who have gone to the airways and to social media to say that they themselves have decided to get the vaccine. But I think most of us would be cautious in that line at this in that group of women. But I will say, of course, what we do know since COVID, as I said, became a thing in America, at least we were made aware of it last year, we're very concerned about currently women being pregnant. So I have tried to encourage, especially those who may be able to hold off and not conceiving right now. That's been my recommendation for many of my patients now. Again, we have to weigh those who may be towards the end of their reproductive years. They're not going to want to wait it out. But right now, the general recommendation is to not receive it. I would have a conversation with your doctor, weigh all the risks and the benefits, and your job. If you're educators, your frontline essential workers, I definitely would take that into consideration.
Okay, and again, there's a question. Someone else want to ask that? Okay, all right. So we have a question dealing with my wife is allergic to Vectrum. Will that impact on her getting the vaccine? And maybe is on Vectrum.
Vectrum, probably.
Vectrum.
Okay. On with the doctors. SAT prep word for the day for me. Let me write that down. Someone like to take that?
Yeah, I would just take it. There's been no case reports in patients who have allergy to Bactrim or shellfish, any contraindications to Moderna or Pfizer vaccine, they do say if you do have an allergic reaction to a component called polyethylene glycol, which is part of the vaccine, that you might, have a reaction, but there's no true contraindication. In people who have severe anaphylaxis, we usually watch and observe them for 30 minutes after the vaccination, just to make sure. And I personally have been vaccinating patients here at Hershey every week, at least twice a week. And, I haven't had any cases, but there's no contraindication of Bactrim.
Okay, so another question that was posted earlier spoke to whether or not you can interchange the vaccines. If you took, okay, so why or why not? And so that's the question.
The CDC has actually spoken to that. The recommendation is to take the same. That became a little controversial recently because people feel like the CDC is flip-flopping. There's a small sentence down the page that says that is speaking to getting the alternative dose may be okay. I'm totally paraphrasing. If the person is unaware of which vaccine that they received the first time, but they too are saying take the same dosage, take the same type, Pfizer twice or Moderna twice.
Gotcha. Okay, so this was along the lines of how I was thinking early on, and it was and this comes from Brother Washington, Stanley Washington. Thank you for your continued support. He states we have to think for a second. They're not going to create a vaccine and have our healthcare professionals take the shot and possibly put them in danger. That would be silly. We need our doctors and nurses. So in other words, why would they take out the frontline workers who are in charge of, who are in essence assigned to take care of us, by putting into you all first, and then I guess killing you all off with regards to the the Tuskegee experiment, and there's no one left to take care of us. So that was always my rationale for when if my number comes up to take the vaccine, a reason why I would take it personally. Anybody else like to touch on that? So that this goes along with our theme as well of then, now, and next. So we know what happened then. This is what's happening now. What do you predict happening next?
So I think that the reason why they came up with a tiered system was because of the fact that the rates of exposure versus, in the community versus directly in healthcare are significantly higher for us as professionals. And so we were the first ones who were offered the opportunity to have the vaccination. And I agree. I don't think that any company or any organization is going to offer something to the workforce and then take us out, because you really can't outsource physicians that well. So ultimately, I think it's just one of those things. There's a lot of reasons to not trust medicine, to not trust healthcare from a Black community, from a Black perspective. But as we're getting these vaccinations and we're being offered this, it's because we are on the front lines and we are unfortunately exposed at higher rates, especially with certain fields. You don't know who's walking in the door and what they have. And so you just have to do the best thing that you can to protect yourself. If you don't have any physicians to take care of patients, then the hospital loses money, the patients don't have providers. And so, yeah, I agree. None of these companies are doing anything to take us out. And so encouraging the rest of the world to go ahead and do what we've done is the reason why we're all on this podcast right now.
You're right. So, and that leads us to another overarching theme and or question, I'll say, which is COVID that we know of here in America is less than a year and a half old. However, there are cures, quote unquote, vaccinations that are being offered. AIDS, cancer, and other ailments have been around for years, and we can't seem to find cures or things, or things to combat that. Could you speak to that, Dr. Henderson?
I'll try, and I don't know if I have all the answers. I think it also the complexity of the condition, as well as how much money invested, in that condition as far as AIDS. And we know millions of dollars were pushed for this Operation Warp Speed, which rightly so, people had reservations on how it was rolled out. That's what some of my patients commented on. But like Nduka said earlier, the mRNA or the Pfizer Moderna vaccine has been tested for at least 20 years. And I believe the two providers or doctors were at University of Pennsylvania. But that's a really complex question. It's hard to know why we don't have a cure for these other conditions, and now we have this effective vaccine for COVID. I don't know how best to answer that. I think when I have patients who have vaccine hesitancy, and the first thing they mention how fast it was approved and rolled out. The only thing I could advise them is it was studied by the FDA, went through the whole process of phase 1, phase 2, phase 3, where the first phase of any vaccine, it has to be safe and effective. So they rolled that out to like maybe 20 or 30 people. Then the second phase roll out to several hundred, and also had to be safe and effective. And then the third phase, they roll out to thousands. So we touched base on the Pfizer vaccine. The Pfizer vaccine was rolled out to 44,000 patients, and the Moderna was 30,000 patients. So it was really tested in every national and every ethnicity. Now, which is important to know because many of us in the Black community, either we don't participate in research clinical trials or we don't know about them. So it's hard to really say how effective a vaccine is going to work in our race. But I think in both of them was around 9.8% of the participants, or like around 2,000 patients. That's not great, but it was 100% effective in both vaccines for our race, if you look at the data. But I don't have an answer for why we don't have a cure for the other vaccines, and that's a good question. I would defer to the other panel.
Yeah, I want to chime in. Science is something that many people don't understand, especially if you've not been immersed in it for your whole career. But cancer, somebody said cancer has been around for about 100 years. No, cancer has been around forever. And if you study what has been happening in oncology, in cancer, great strides have been made in cancer, right? In leukemias and lymphomas, and so a lot of work has been done on the scientific end for these diseases. Now we're looking at corona right now, and we're looking at mutations, right? Because these viruses they're pretty smart. So the question is, what is the variance? What is going to happen with the variants? And yes, there will be diseases that are very complex that will last for many, many, many years. But how many people are truly dying from HIV now in terms of the good medication that has been created? So I do want to take the time to inject something, because I know we just skimmed right over the Tuskegee and the Henrietta Lacks, etc. But the question that I always pose to people currently is, what is killing us? What is killing us as a people? Right? Somebody asked about infertility, right? You know what causes infertility? Morbid obesity, uncontrolled high blood pressure, uncontrolled diabetes. And these are the things that's killing us. There's so many of us, 40% of us on dialysis. So that is the issues that we have to address as a people. And in talking about the history, we got to continue to talk about the history. Not when a question like this. I've been talking about this for years. So we have to better understand the history. Many people hear about the Tuskegee experiment and they don't even understand what it was about, right? So it's up to us to try to educate. But as a people, we got to understand some of the science, and we have to understand the things that are really killing us in society right now, the foods that we eat, et cetera, et cetera, and not necessarily they're trying to take us out with a vaccine. So, these are the kind of things that folks have to understand. If you look, I want to emphasize the cancer and the research that has been done in with leukemia and many other cancers. So advancement in science has been tremendous. And I think vaccination in of itself is one of the greatest accomplishments in medicine and has saved many of us and family members. And some of us exist today because of vaccination. So take, for example, I always talk about polio vaccine. So, there we are. It's not just black and white. There's a lot behind the science, and we have to give them credit. And in the forefront of a lot of the scientific research right now are Black people, right? Corbett, I think Dr. Corbett at the NIH is a Black woman doing tremendous work on the coronavirus vaccine.
Can I jump in, Karl?
Certainly.
To Dr. Dangoben's point, because it frustrates me, but I understand misinformation, disinformation, but it frustrates me even the history, to your point, sir, about the Tuskegee experiment. I polled an informal poll of colleagues in a Facebook group that I'm in, physician group, and asked them, what do y'all understand about the Tuskegee experiment? And people don't even understand. Physicians, don't understand what the Tuskegee experiment was. And what I will hear from my patients and even some colleagues is that what they were giving, they were injecting Black men. And I'm not trying to be the leader and say, oh, no, that's not what government was doing, rah-rah for them. But understand what happened. Up close to 400 men, sharecroppers in Alabama, were studied somewhere between 1932 and 1972. It was a 40-year experiment research. The problem is those who already had syphilis, once they found that penicillin, which was already discovered, and found out that it was the treatment for syphilis, they withheld it. They withheld it and allowed it to propagate in our communities. So misinformation continues to go down the chain, down through the families. Everyone quotes and loves to say that term because they'll remember the Tuskegee experiment, but they don't even understand what happened. The other thing, you spoke to Henrietta Lacks. I not to get deep, but my colleagues, of course, understand about the immortal cells of Henrietta Lacks. But cancers are different. One of the best studied cancers in my field comes from a Black woman, Henrietta Lacks, in 1951, I believe, when she died, and they took the cells at Johns Hopkins, took her cells from her cancer, her cervix, and used them without consent, without notification of her before her death or even her family members until decades later. And because of her sacrifice, not even knowing what she was doing, we have so much information, and specifically to your point about cancers, it is very complex. But another vaccine, the general name Gardasil 9, can prevent, so much so that in Australia, 2021 was slated to be the year that they said that they had eradicated the disease. That's a different conversation around mandating vaccinations. This country, everyone has rights, and nobody wants vaccination. But I'll stop with that to tell you, Karl, your past teacher, my mother, shared with me. She was born in 1939. She doesn't mind telling people she's 81. She remembers a day when they were bused to go and get that polio vaccine. Who here talks about polio now? So I would urge those in the audience to just continue to have the conversations. Talk to your doctors, your people that you trust. Don't keep echoing some of the same misinformation that has just been told at the dinner tables and throughout history.
This is a great shameless plug here at this time. Shout out to the great Harrisburg High School, 1990 class of 1991, as well as the Dr. Adams, our chemistry teacher. I'm a little choked up on that one. But again, Shout out to Miss Adams. Love you. Dr. Adams, check that. We had
Yep.
doctors teaching us at that time. Did I cut someone off? I apologize with my shameless plug for high.
I was about to give two hands and piggyback off of Dr. Adams Burt. So I'll be brief. So yes, that was the biggest part of the Tuskegee experiment, was that they had treatment, did not give it, withheld, studied the severity and what would happen, even knowing there was treatment and you could prevent these diseases. And that's the most egregious aspect of that experiment. And I want to mention that to say, the thing about the Moderna and Pfizer vaccines is that they had actually planned on studying the results longer. They were studying the results in these patients for months. It was so effective across all races, mostly all ages. And I say mostly because it wasn't targeted very specifically towards kids, but across all races, that you couldn't withhold this medication, this vaccine anymore. It would have been unethical, right? So the problem with Tuskegee is that they had treatment. They knew it was effective and didn't give it. We have a vaccine. We know it's effective. Now we're giving it. There's a huge difference here. And I wanted to piggyback on that, because that's a great point in terms of understanding the history behind the Tuskegee experiment.
I just feel like I haven't heard from Dr. Fitzgerald for a second. Feel free.
Well, I'm glad you just called me out, because I wanted to say something anyway. So, I completely echo the sentiments of Dr. Burt and Dr. Njoku. One of the things that we fail to recognize sometimes is the fact that all of the research that we've done on HIV, AIDS, and cancer over the years have resulted in significant treatments. Whereas when you look at 1980, when we first started hearing about AIDS and HIV, people were dying left and right. Now it's not a death sentence. It's a disease that's manageable. People can live normal lives for years. And I think that we fail to recognize that because we're so concerned about the fact that we haven't eradicated it yet. Same thing with cancer. Cancer is such a changing thing. And, these diseases mutate. They're all different types, but we've found ways to manage them. And if you look at the Gardasil vaccine, for HPV, to prevent cervical cancer and other things associated with the HPV virus, we've done a tremendous job with that. And making sure that people are vaccinated at an early age has definitely decreased the rates of that. And so from that standpoint, I think that we as a people need to not be so skeptical. We always quote the Tuskegee experiment or talk about Henrietta Lacks, but let's look at the other things that we've accomplished and the other things that we've been able to manage and now live through that we wouldn't have been able to do 40 years ago. So ultimately, yes, it is a scary thing with how quickly this was turned around from the COVID perspective, but look at how we were dying from it and all of the side effects of COVID, how it's affected not only just your overall livelihood, but how it's changed the family dynamic. I've known people who've recovered from it, and I've also known people who've lost their parents, their grandparents from it. And that's not something that you can really come back from. So our skepticism needs to be met with a little bit of realism as well.
Definitely. So is the vaccine to prevent you from not getting as sick or dying? The vaccine isn't really a cure, as is with the flu shot. I'm sure people had the same reservation in the early 1900s. My loved one would not take the flu shot, but will be taking the flu shot back. Will be taking the COVID vaccine for the love of one of his own in his life. So that is a long-winded question. I definitely had to put that out there. That question came from my mother. That statement, actually, it was not a question. That love when she's speaking about is me. I was not taking the flu shot. I swore against it. So in order for me to, there it is. Thanks a lot, Pat. Shout out to the control room. Now, is there something that we could coalesce around? If there was a message that we would like to give those that are watching us this evening around understanding their hesitancy to take the shot, however, couple that with basically the risk versus reward. If you'd like to touch on that a bit as we begin to wind down a bit, then I will call on Dr. Dangleben.
Okay. To talk about the risk, I always said that ever since I did the first shot, that the risk of the vaccine is much less than actually getting COVID. And as the other trauma doc said, we are on the front line. We've seen what we've seen. I had one gentleman come in one night after being attacked, and I was in the operating room with him that night, and the next day he was positive. We had several other patients in the ICU at the time, not doing well, and quite a few died. So when you see that and you see what this disease can do, right, that it makes sense. So when folks are out there screaming, open the stores and give me my mask and do this and do that, and we're in the ICU with the mask on for several hours, or we're in the operating room in somebody's chest who's COVID positive, then that sort of brings things home to make you understand what's going on. And then when you see the elderly patients coming in, shortness of breath and dying miserable deaths, then it sort of makes sense. So the risk-benefit ratio, it speaks volume in why this should be done. And I would say it again, I would roll up my sleeve any day for this. And we talk about COVID, not just as a disease, but look at what it has done emotionally, psychologically, and so financially, to us. So for us to get back to what we know as normal or somewhat normal, we need that herd immunity through vaccination. And I cannot say enough why we need to go that route. And I just want to say something real quick. Everyone, I've spoken about this many times. In 2012, the Middle East respiratory syndrome was coming, and they were pushing the mRNA vaccine, but it never hit like COVID, right? So the groundwork was there since 2012, and then Zika virus, which America never saw, which ravaged the Caribbean and South America, they were working on the mRNA vaccine. So people have to understand this thing. The blueprint was already there. Okay, so this is not expedited just because COVID came in 2020. That work was being done for at least, like someone said, in the 90s, and they were moving quickly when MERS was coming and Zika was on the rampage.
Okay, thank you for sharing that.
I think one thing that I have said to patients that's made me kind of laugh is what I said at the onset of my intro is Operation Warp Speed, right? That phraseology is problematic. It reminds me, and I'm not going to make this into a political conversation, but it just makes. But no, I'm saying it reminds me of what the right versus left during the election, during all of the campaigning, and people scared folks about defund the police, and then even, President Obama and others said, well, we don't mean, that may not be the correct phrase to use because we don't really want to defund the whole thing. Sometimes it's about the verbiage. And I tease with my patients and I say, well, perhaps if they would have called it Operation Heal the Land, would you have gotten on board then? It just sounds different, But one thing, as African-American Black physicians, I do want to say, because I'm telling you, I'm sure my colleagues have seen, it's not just now, it's almost like it's not a distrust in healthcare in general. It's a distrust sometimes with us, like we are on the other side. They got a hold of you. So I'm hoping people realize that we are in these families. Like these are our mothers and fathers and our grandparents and our children. We are dealing with many of the same things that the rest of you who are paying attention and listening in are dealing with. So they don't defend the Black doctors against the Black community. We, as the good doctor just shared, we've been trying to get folks, away from dialysis. Like now, 20 years ago, we were talking about, liquor stores at every corner. I don't know about in Pennsylvania, but down here, there are dialysis centers on every other corner that are popping up night and day. We are trying our best to get our message to our people because there are so many areas that we need to address. The obesity, we talk, you hear it all the time about comorbidities. What are we talking about? Living with other illnesses and how they impact on top of each other. The diabetes, people don't die from diabetes. Diabetes itself is not type 2 diabetes. It's not just kill people. It's the manifestations that diabetes does to the body, to the kidneys, to the vascular system, to the heart. So we're trying to get you. When your doctor says you have pre-diabetes, listen up. Take heed. Women, my patients come in with blood pressures 180 over 110. Oh, I forgot to take my medicine. No, you need this. Just like you need oxygen to breathe, you need this to live. And so we're doing our best to get out there. Thank you, Karl, again for this platform and many others. I'm a member, hopefully my colleagues are too, of the National Medical Association, which is the oldest national organization for African-American physicians. We're doing our best to get out there and share so that people will stop looking at us like we've sold out to the man. No, we are completely sold out to helping you and others in our community.
Okay, thank you very much for that.
I'd just like to echo that. One of the things that we constantly hear, especially when you go through higher education, is that, oh, you've sold out, you're no longer part of the community. But the truth is, there are a lot of us, especially the people on this panel right now, who are extremely active in advocating for our communities because we are a part of the community. When we walk into a physician's office ourselves, if we don't say that we're doctors, we get treated the same way. And so the narrative has to be changed. And we're the ones who are fighting for that now. I'm not sure how many people have actually seen this video, but it was very disturbing for me to see someone who was being treated at Indiana University. She was a physician who had COVID, who was treated poorly and ultimately died. And despite the fact that she was a physician, she's educated, she has all of this information in front of her, she still got treated just as poorly as some of the other people within our community. And so that's the reason why we continue to fight and push and work towards creating a different environment. And by being the faces on the front line, by being the faces here today to talk to the community, we're trying to do our part to change the whole narrative in medicine so that we can create a safe space for our patients and ourselves.
Definitely. Another question was asking, if there are individuals with respiratory problems, okay, if there are individuals with respiratory problems, should they be taking the vaccine, either or if there's a preference? And this individual stated that they are also over the age of 60. Sure.
The answer is yes. If you look at respiratory illness, the highest risk condition is COPD patients. It hasn't really been associated with asthma, but COPD patients. So if you look at, as was well stated before, what conditions affect African-American communities besides diabetes and hypertension, which those two primarily lead to chronic kidney disease, which will lead to dialysis. But COPD, just looking at the incidence of smoking in the Black community and how it affects the Black community. So now we already have these conditions that's affecting us disproportionately, and now we have COVID on board. So I had a patient last week, new patient, 39 years of age, who had kidney transplant twice, secondary to lupus. And we didn't even touch base on rheumatological conditions that affect the Black community. But he had a kidney transplant ×2, was on medication to suppress his immune system, as well as high blood pressure. And I asked him that question. If you had a chance to get the vaccine now, would you get the vaccine? He said no. Now, I looked at him and talked to him for 20 minutes and addressed his concern. We talked about the Tuskegee experiment. His answer was he didn't like the way the vaccine was rolled out, the urgency of it. So I tried to convince that your risk of dying if you get COVID is so high not only because you have lupus and you have a kidney transplant and you're immunosuppressed. I said, do you have kids? And he said, yes. I said, so do this for your kids, because if you get COVID, there's a high chance that you will die. And that's what I try to do to most of my patients. I try to personalize it. But here's the other thing. We have to educate and inform of our community that we're already behind the 8 ball with our medical conditions that affects us. So if we don't get the vaccine, knowing that rightly so, the hesitancy that we have, but at least that's one tool that we have. Now, if you say, well, the flu vaccine, there's issues with the flu vaccine is only 40% effective, maybe 50%. And you can still get the flu even if you had the vaccine, but it won't be as severe. Whereas this vaccine for Moderna and Pfizer is 95%. So I just say that, comparison the two, we just really have to push home and educate and inform, our community.
Thank you very much. We have another question from Ms. Ponce Smith. Great topic. However, how long does the vaccination last? Is it like the flu shot needing to be taken every year, or is it something that you do one and done? Let's go, Mr. Nduko. Let's get you back here, Dr. Nduko.
So the answer to that question is we don't truthfully know. It's the disease is too new. The vaccination is too new. And the response time in terms of how long the people who have been in the research studies, right, that determine the release of these vaccines are still being studied. So we don't know. We don't know how long the immunization will last. And then we also want to know, is it immunization that's going to be effective against these different variants? Now, given the efficacy, how we've been able to reach 95% efficacy is pivotal. Because if you can reach 95% efficacy, that means you are stopping the disease in its tracks, basically in its tracks. And if you do catch it, you don't get severe disease, right? So the risk of you dying essentially gets nullified by taking the vaccine and completing the series. Now, granted, we don't know yet, but let's say the vaccine only lasts a year. Let's just say it, right? But if you have the entire nation vaccinated at 95% with essentially no chance of dying over the course of the year, and everyone's getting vaccinated at different rates throughout the year, you are essentially creating the entire community around you who are protecting you, right? If they're going to survive the disease if they catch it, and if you need to get vaccinated next year again, well, then you can survive it. You can survive it when it's time. You're protected by enough people around you. It's the concept of herd immunity. Other people protecting you, being protected being protected because other people vaccinated, and protecting other people because you were vaccinated. Now, I understand the concept of, well, do I have to keep getting this injection? The truth of the matter is we don't know. We're hopeful. 95% is really impressive. It's really impressive, but it's too new. It is too new for anyone to say that with any kind of definitive response that yes, this will be the one time you get it. Who knows? Maybe it's 5 years. Maybe it's 10 years. The truthful answer is that we just don't know.
Thank you for that. So we have another question from Miss Krista Page. How long do clinical trials typically take to complete before they are approved for use under normal circumstances? So is that acknowledgement that these aren't normal circumstances first, but then how long does it typically take for these trials to be completed? We'll send that to Dr. Adams Burke.
Why me? Years.
You're allowed to pass.
I think it was answered, was kind of suggested earlier. The different phases for this vaccine, definitely the warp speed part comes in, that instead of waiting for phase 1 and then time lapses, then phase 2 time lapses. Once we got to, say, they kind of did the phases at the same time. So that's how things were ramped up. But it definitely takes years for not only vaccinations, but for medications. I do want to say, though it's not been actually asked, there is no approved medication or vaccination. I'll say vaccination. When all of us took our vaccines, our consent form in bold, at least mine did, said, understand that there are no approved vaccinations for COVID-19. And I did stop for a second when I got to that part, but emergency use authorization is different. They're saying the information that we have as of now seems to show that this is safe and efficacious. It's going to be effective for you. So still take it at your own risk. We have to have informed consent, of course, with anything. But the answer is definitely, we all understand that. Warp speed truly was warp speed as far as from the beginning of this particular. But to my colleague's point, the study of the mRNA, and I'm not an immunologist by any means, but the study of using this technology, that part is not new. It's as if someone had a formula and just put the new numbers into the formula. The new numbers was the genomics, the study of the viral genome, meaning the makeup of the virus had to be put in and fixed in to the formula that they had already discovered some years ago.
Thank you very much for that. Anybody else have something to add on that? Okay. All right. So let's go here. What would you say? We want to switch gears a little bit here. What would you, as professionals today, understanding the current climate that we're living in, what would you say? Sooner than later, you're going to retire, have those nice, vacation spots on an island somewhere. So what would you say to those that are coming behind you, or those that may not be certain of the career pathways that they would like to take, especially our young Black males and females? What would you say to them to encourage them to stay actively engaged in the education process, especially dealing with, the COVID restrictions of being home, not really being engaged with friends, so forth and so on, in the traditional way? What would you say to inspire them today to go into this career path as they look to be successful, not only educationally, but socially post-COVID? We'll start with Dr. Fitzgerald.
I think one of the things that I would say is that this too shall pass. I know that sounds very cliche, but I think that every generation has seen its own share of pandemics and has come out stronger at the other side of it. Going into the field of medicine, it's definitely challenging and poses its own journey. When you think about the different residency programs, everybody on this panel has essentially been through a different program at a different place and has ultimately chosen their career path. But I think just knowing that you make a difference every day that you step into work makes it more rewarding. And you don't realize how many lives you touch, because sometimes you feel like at the end of the day, you've been beaten down or you lose a patient. And it just feels like it may not be worth it. But then you have those other days where you realize that you were able to make a difference. Somehow somebody came through something that they might not have come through if you weren't there. So remembering that those things do happen more frequently than the other aspects of your job do make it more rewarding. And I think at the end of your career, when you can look back and say that you've made a difference, that's when it all just is worth it. It's difficult. I didn't see my mother for almost a year because of COVID. And thanks to the vaccine and everything else, I feel a little bit more comfortable now. And so it will get better as more of us are educated about the processes of the vaccine and realize that social distancing, mask wearing, hand washing, all of those things will keep us safe at the end.
Others.
I think I want to jump in. I think pre-COVID, post-COVID, intra-COVID, whatever you want to call it, there's many things that we don't do well as a community. Social programs, mental health. Some of it I think arose from some what I call full culture, and I think a lot of our folks deal with these things. So we look at numbers and we look at correct me if I'm wrong. There were more Black male physicians in 1978 than there are today. We need to start looking and paying attention to what is going on, minus COVID. What is happening to our young men and our young women in elementary education and high school education, and start mentorship programs. We are too individualistic as we move through this channel. Many of us, and I'm sure those on the panel, it's been a rough road. I sometimes I say, folks, I'm sort of 50-50 on whether or not I would do this over again. Let's be honest about it. You have to be able to speak very boldly and very honest about where we stand as a people. So we have to support the young ones because they're being broken before they can even get to the point. So few of us come out and become physicians and get to this point. But we have to be able to go back and start mentorship programs, social programs, and focus a lot more on mental health in the Black community.
I'm sure there's others that like to jump in on that one.
There's so much to jump in. What gets me going, or what I do every day, is I know it's such a need. We all know how much the distrust that the Black community has in the health system. So I have to do my part to instill trust, to dispel any misinformation, because if not, I know the end result. So if I can encourage another young Black physician, Black young gentlemen, support and encourage, because we need other physicians of color to take care of the communities. That's just a given. Patients many times come to me and they say, I research you, I trust you because you're Black. Now, I've been practicing for 23 years, but we know that's a given. So there's so much that's needed. And it's even more challenging with COVID to convince our patients about the vaccine. But I decided, I talk about cases, and there was a patient who I just saw last Friday who I was about to give the vaccine to, and she had tears in her eyes, and she was in a wheelchair. And she had diabetes, she had hypertension, she had significant obesity. And I looked at her age, and she was the same age as myself, and she looked older. And she had chronic kidney disease. And her sister just died, who was age 57, a week before. And she was scared to get the vaccine. And she also had heart failure. So I asked her, I said, are other family members coming to get the vaccine or scheduled to get the vaccine? She says they're waiting to see my response. If I die from the vaccine, then they know. So that's the reality. Wow. The fear is there, but I was able to talk to her and convince her to try to encourage others to get the vaccine, and that she had trust in me. So it's challenging what we all go through every day. And then I also have patients who do not believe in COVID, who don't believe in the vaccine. And actually, I have one patient 2 months ago when I walked in the room, he had his mask off. And I said, please wear your mask. I said, your wife just tested positive. And this patient had no symptoms. And we didn't talk about the 20 to 50% of people who are asymptomatic. But I asked him, I said, please wear your mask because, you know, you are the asymptomatic patients. He looked at me and he said, Doc, you asked me to wear my mask and I'll wear it. And I said, but what if I get COVID from you? Or if the next patient gets COVID from you, what would you do? He looked at me in the eyes and he said, you asked me to wear the mask and I'll wear it. And this patient was not African-American. I say that because we're dealing with a segment of the population who don't care. And we have to deal with that. As physicians, we risk ourselves every day to take care of patients, regardless of race, regardless of politics. But it made me think twice about what I do, and I still do it again. But I just wanted to mention that.
Definitely. That brings up the asymptomatic topic has been something that we did omit, but we still have time. The other piece that we wanted to touch on, not saying a bit and brushing it off, but in terms of children being vaccinated, we heard the current administration or the CDC come out since this new administration has been in office and talk about teachers possibly not needing to be vaccinated before schools are reopened, and then slowly walk that back over the last couple of days. What are your thoughts around the asymptomatic threat, we'll say, or population that's out there, as well as the topic of children catching COVID and or being vaccinated, not only before school, but vaccinated overall? Whoever would like to jump, I'll say, Dr. Nduku, I think you're trying to duck out on me there.
I was leaning out of the frame. No, but seriously. So the asymptomatic population is the reason why this disease is so very scary. Think about it. You could be in a room with 10 people, and statistically nowadays, that means someone in that room has COVID. And if they're all asymptomatic, depending on how long you sit in that room with that person, long enough, everybody walks out of there infected. And it's because someone's asymptomatic. It'd be different if you knew that if you sit in a room with 10 people, and if they're positive with COVID, one person's going to be coughing, because then all 9 other people would take 10 steps back. Because we know how deadly it is. We may take risks. People might not wear their mask. People might not be skeptical, but when it's in their face, I've seen many people in the hospital change their tune because they thought, well, I didn't believe it. Now I have it. I didn't believe it, but a family member had it, but I thought I'd be okay. I'd be asymptomatic. Or I had 5 friends who had COVID. They're all fine. They didn't show any symptoms. As a matter of fact, sadly, I've heard a young person say, well, all my friends got it. I was just waiting to get it. I expected to get it, so I wasn't going to take the precautions. I wanted to get it over with. They ended up in the hospital for an extended period of time. The reason the vaccination is so important, the reason the disease process is so important, is because of asymptomatic carriers, which leads into children. There's been conflicting data, right? And I feel like the story and the information I hear the most is, well, they're young, they'll be fine. Folks, children have died from this. Many children have died from this. The youngest person I saw in the hospital was in their 20s, died from this. They keep dying from this. And what makes it scary is that kids need interaction. It's part of the development. They need other people, and they rely on other people. If those kids are asymptomatic, and you say, well, if they infect another child, no big deal, they'll survive this, and you're wrong. It's a life snuffed out, and it's not that kid's fault. I personally feel we need to vaccinate as many children as we can as we try to get them back in schools. Education is extraordinarily valuable and extraordinarily important, and I say that as someone who has 2 professional degrees. It's important, but we have to do it safely. reasonably. It can't be rushed. And that's where I stand on that.
Okay. Thank you for sharing that. What we'll do now is we'll take a brief commercial break. And on the other side of this, we are going to have our concluding remarks, at which point you can take 2 minutes to close out. At that time, I will definitely continue to share your information here on this podcast. We will also be posting it, as you know, to our YouTube channel. As you see the comments coming in, we can't thank you all enough for thinking they're not robbery to come and share your level of expertise, your ongoing knowledge, and learning as we go through not only this process but this pandemic that has, ravaged many of our communities, in particular our Black communities that were already suffering on the wrong side of those social determinants of health. Before we go to commercial, I'd just like to say, because this is dealing with young people, I can't think of a better young person to highlight at this point than, I'm going to just call him Dr. Trent Gray Jr., who will be coming out of med school this spring. He is one of Harrisburg's shining stars. Historically, we have, as we know, been put in media in very negative light. It will be a distinct honor and pleasure if I am able to get Trent on this podcast, soon to be Dr. Trent Gray Jr. So with that, we're going to take a brief commercial break, and we'll come back with a 2-minute closeout, please. Thank you. Now that we're all back, one of the things I'll ask as we close out is, doctors, plural, if you wouldn't mind jumping into either on Facebook or YouTube when you're, after we're off set, if you can go in and personally interact with some of our guests with regards to the questions they had, that would be greatly appreciated. As we always say, just because we close out here on the podcast doesn't mean the topics have to stop. These podcasts are living documents. These are living podcasts. So we continue that engagement. Don't forget, those of you watching on the YouTube side, to not only like, but subscribe. As we move forward, we want to ensure that we continue to have this location, which is 100% Black and owned, promoted in our communities. So please definitely like and share this. We're going to roll now into our closing, and we're going to go from bottom on the screen, my good brother, Dr. Nduku. But before we do that, Black Doc Project, Black Doc, if I can get Dr. Dangleben, if you want to join in now, we have had conversation around this. If you can talk a little bit about Black Doc at this point, and then we're going to go back down and go from the bottom of the screen up with Dr. Nduku. So Dr. Dangleben, and then we'll go up.
Yeah, Black Doc, BLAC, capital DOC, is a project that we're currently working on. It's really a tech project where the physician will have one app and the patient will have another, where patients can quickly get a hold of us. We would respond within an hour with any questions that they might have. They can send video, they can send audio, they can send PDFs, etc. So that's a project that we're moving on quickly. That should be hopefully be going into beta phase in about 4 to 6 weeks. And I'm just hoping that all the people on the panel we can connect, because we're in very close proximity, and I've never even seen or heard of any of you guys. So that would be great if we can connect.
See, another benefit of Music Man Multimedia Studios. So if you wouldn't mind, we're going to go to my good brothers, start closing us out here. As I promised you before, you won't be last. So please, sir, thank you.
Thank you, sir. No, so now I see the pressure of going first. I see what you did there. Smart. So a lot has been covered. We've covered a lot, right? We've tried to dispel rumors and address concerns and fears, answer legitimate questions. We've told you what we know, and we've told you, the truth, right? And things about that we don't know. I really hope, right? I really hope that if there were some of you who weren't interested in getting the vaccine or were going to wait, that this has changed your perspective, and that you can then go and take what you learned or what you've gleaned and can change someone else's perspective and use whatever strategy you need, right? Is it facts? Is it professional testimony? Do you need to text us and we'll come back on this and reiterate it? Sure. But the sooner we can convince our neighbors to become vaccinated, the sooner you get vaccinated, the sooner our children get vaccinated, is the sooner we all party together. The sooner we all stand in each other's company, embrace our loved ones, not be fearful of the stranger who walks next to you and might have had a tickle in their throat. So I say that, yes, jokingly, but it's kind of the reality of where we live now. It's important. It's important. Get vaccinated. Convince others to get vaccinated. I'll come on this show and do it a million times if it gets one more person to get vaccinated who would have said no. It's that important.
And all of you are more than welcome. Hopefully this is an ongoing open line of communication with all of us. So definitely, Dr. Fitzgerald.
I think that one of the things I want people to take home is that just because we have doctor in our title doesn't mean that we're still not people who have unfortunately had to live through this quote unquote new normal. This should not be our new normal. We all have to do our part in order to get back to the way things used to be, where we could walk down the street, we could see our family members, we didn't have to be so isolated. And unfortunately, yes, there's some concern and everybody has a reason to be afraid, but we're all out here trying to do our part so that we can get back to the real normal and not this new normal. Making sure that we continue to educate each other and continue to learn and grow is imperative to being able to get back some sense of normalcy. I know that it's all scary and you don't necessarily want to listen to me, but I'm in this fight with you and I'm happy to come back on and share more stories, but it shouldn't take having to see somebody die before you realize that this disease is real and it's affecting us in numbers that you can only imagine. So do your part and stay educated.
Dr. Henderson.
Thank you. There's so much that was touched base on tonight. And, where do we start? Hopefully I have convinced you. But one thing I can say, don't wait to get the vaccine. And also, if you know you have conditions of high blood pressure, obesity, specifically your BMI, know your BMI. That places you at a significant risk. If you have chronic kidney disease and diabetes, know if you do get this virus, you could die. You have to know that. It's taken your life in your hands if you choose not to get the vaccine because we're already at a significant risk just from our race. Know if you do have lupus or you have rheumatoid arthritis or if you have any autoimmune conditions, if you get COVID, you could die because those conditions place you at a significant risk of having what's called a blood clot or pulmonary embolism. One of my coworkers died December 4th, and she was only 40 years of age, and she died of massive pulmonary embolism. So, we're all willing to come here as often as possible to educate, to inform, but don't wait, because the more that we wait and possibly get infected, we didn't talk about the variants, but there's more chance this virus will replicate, and there's more chance for another variant to develop. So if we ever want to get to some normalcy, and we're all tired of the mask, but if we wait and wait, there's going to be another variant in a matter of time, and then the Pfizer and Moderna vaccine may not be as effective. It's still going to be effective, but who knows? So I would say get the vaccine, not for yourself, yes, to protect yourself, but do it for your family. Do it for everyone else so we can get to 85% of herd immunity. And that's where we need to get to 85%. And then maybe in the fall, we'd have some form of normalcy and for our kids to go back to school. And so I'm just honored to be a part of this panel. I was educated myself, and I'm just great to be here. So thank you.
Dr. Dangleben.
Yeah, I would say go ahead and get the vaccine. I think things that we're currently worried about, this agenda of eradication, I think we must look deep into the mirror. As a people, a community, we need to look at what is really, truly killing us. The early grave, the things that we try to sweep under the rug, like Black men smoking less and dying more, prostate cancer rates lower, younger Black men, the increased death from strokes, the food appetite that is destroying us with obesity and diabetes and things like that. This, to me, are more worrisome than this vaccine. And these are the things that we need to continue to speak about, that I have been speaking about, that's killing us as a people. And these are the kind of things that I think we must come together and have that agenda to address all these issues. Because we don't question what Viagra does and how it can kill you and stop your heart and things like that. But now we sit there and we question the vaccine. So my appeal tonight is this. We must look at ourselves in the mirror and look at the things that are killing us as a people. If we're worried about the eradication agenda, I think we've missed the boat, because we're being killed by food, by salt, by sugar, by basic things that we've gotten so accustomed to and addicted to. So go ahead and let's start educating ourselves. Let's start educating each other. And let's start taking this to a different level. This individualistic madness, we need to come together as a community, as a collective, because we're better together. Thank you.
Black Doc. Again, Black Doc. And Dr. Nduku, don't take this the wrong way. I've really, truly wanted to start with you first, because I promised you. However, it just so happens that in starting with you first, you allowed us to end with Harrisburg High's own. So, Doctor, if you will.
Yes, thank you. I'm just going to say to all of those in the community, I need you to get on board and get in line, because this year marks Karl and my 30th high school reunion from Harrisburg High, class of 1991, and we are trying to plan a 30th reunion, and it may end up being virtual, depending on what these numbers will be. But because I know mentorship is a big thing for both of us, I want to end. Thank you to, of course, Karl, for having me, but thank you for introducing me to my colleagues tonight. I would love to get you guys information, but I also wanted to share my final words to the young people who may be listening or have an opportunity in the near future. Over 1 million, as of March of last year, there's over 1 million physicians in the United States. And according to the AAMC, the Association of American Medical Colleges, 5% of that million are Black or African American, 5%. And even 2% of the whole number are African American women physicians and surgeons. And so, to the point that someone asked earlier, well, how can we have a vaccine but yet not have the cure to AIDS or cure to all cancers? I just want to kind of quote the great UNCF that says a mind is a terrible thing to waste. And it also makes me think that the cure to cancer may be in someone who may not have the means, the opportunity, or the push to go to college. And I just want to encourage you that we need you. We need you to carry the torch and to continue to help fight the good fight. And it may not be in medicine, may not be in surgery. Maybe I need you to be like our sister down at the NIH, doing the work in the labs and creating the vaccine. So STEM is extremely important. We want to encourage you that you can do it. All of us have our different stories of how we got here, but we need you to increase the face of medicine to look like the community, because studies time after time show that our people listen more to physicians that look like them. So thank you again, Karl.
Thank you all. And again, I would just ask that if you all wouldn't mind going into the comment section on the Seat at the Table Facebook page, as well as on the YouTube channel. Those of you who are interested in knowing more about the doctors or our panelists here this evening, we will be posting their information in terms of where they're located, their area of expertise on our on the website under the Facebook page of A Seat at the Table, as well as on YouTube. So with that, thank you all for being here tonight. Again, docs, if you wouldn't mind, please take a couple minutes and go into the comment section. We're continuing to get questions in, and there may even be some speaking specifically to you. And we are going to continue to encourage our good young scholars out here to stay the course, not give up, and use Brother Trent Gray, soon to be Dr. Trent Gray Jr., as a model. With that, I would just like to say, hopefully this will be one of the last times I have to end on I won't say a sour note, but in a celebratory note with regards to a homegoing service of another great community advocate, child advocate, community member, brother, that I'm not going to say lost, but has gained his wings. And that is Mr. Tracy Ellis, who is a mainstay with our young people in the Boys and Girls Club, historically, always with a positive word to say, always a dancer, always a giving person. He is going from labor to reward, gained his wings, and his life will be celebrated tomorrow at the H. Major Winfield funeral home. So again, we love you. We miss you. Harrisburg has lost another. As a matter of fact, Harrisburg has had another great public servant ascend out of our physical midst, but remains here with us spiritually in the lives of not only his own kids and family members, but in all of the young people that he touched with the Boys and Girls Club, as referee, as coach, and other great positions that he's had. Again, Mr. Tracy Ellis, thank you all again for joining us here. A Seat at the Table. We are here every Monday and Thursday from 6 to 8 p.m. Continue to support. Thank you. God bless you.
What?